Hi, you guys. Welcome back for our daily practice questions. It is day 146 and day 16 of our Pharm series. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And don't forget to hit the subscribe button so you don't miss any of my videos. And if you're looking to gain access to my MP Test Success Toolkit, it's free and linked in the description. All right, question number one states a 52-year-old woman has triglycerides of 280 milligrams per deciliter and an LDL of 160 milligrams per deciliter. What is the most appropriate first line pharmacologic treatment? Is it A, a fibrate? Is it B, omega 3 fatty acids? Is it C, a statin? Or is it D, niacin? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, what is the most appropriate first-line pharmacologic treatment? You know what I always say, if they're looking for a treatment, you got to run it back and see if they provided you with a diagnosis. And if they have not provided you with a diagnosis, you need to run it back a step further and look at those assessment findings so that you're able to determine what it is, because you got to know what it is to be able to treat it, right? So we don't have a diagnosis provided, but we're looking at lab values from a lipid panel, right? So we have a 52-year-old female has triglycerides of 280 milligrams per deciliter, which we know is elevated. We want those triglycerides to be less than 150, and an LDL of 160 milligrams per deciliter, which is also elevated, as we want this less than 100, right? Now, how do you know what you need to focus in on first? Remember, the only time that we go and focus in on the triglycerides first is if they are 500 or greater. Here, they're not. They're elevated, but they're not greater than 500. So our main focus is to get that bad cholesterol reduced, which is your LDL, right? So C is your best answer because remember, statins are utilized to reduce the LDL. Question number two. A 60-year-old male with type 2 diabetes has an LDL of 115 milligrams per deciliter. According to ACC and AHA guidelines, what is the recommended first-line therapy option? Is it A, lifestyle changes only? Is it B, fibrate? Is it C, statin therapy? Or is it D, niacin? Take a moment and tell me what you got. All right, and stem of the question here states, according to the ACC and AHA guideline, what is the recommended first-line lipid lowering therapy? All right, so same scenario here. You're going to start with their C, statin therapy, because you are reducing the LDL. The LDL is still exceeding 100. They do have a history of type 2 diabetes, which is one of those cardiovascular risk factors. So we want to go ahead and treat with a medication. So statin therapy, go ahead and start your statins. And lastly, question number three. A 48-year-old woman presents with an LDL of 160 milligrams per deciliter and triglycerides of 350 milligrams per deciliter. Which of the following is the best first-line pharmacologic therapy? Is it A, a fibrate? Is it B, a statin? Is it C, a niacin? Or is it D, omega 3 fatty acids? Take a moment and tell me what you got in the comments, y'all. All right. So, stem of the question states, which of the following is the best first line pharmacologic therapy, right? So, what are we treating? So, we have a 48-year-old female. Her LDL is 160 and her triglycerides are 350. All right. So, we definitely need to start a medication to manage this. Again, we focus on the LDL first unless the triglycerides are greater than 500. So again, the answer is B, your statins. We want to reduce the LDL, your bad cholesterol. Now, those triglycerides are getting up there. If when started on these statins and you don't there's not a reduction in your triglycerides, they continue to be elevated, you can then start to add on your other medications. So you can add in your niacins, your fibrates, and your omega-3 fatty acids, right? That's when you start to go next to your next steps of treatment to help to reduce this. But you're going to first utilize your statins, and we have low intensity, moderate intensity, and high intensity statins. So once you have maxed out those statins and you're not seeing the adequate reduction, then you can add on another medication to help reduce these other areas, okay? But again, unless those triglycerides are 500 or greater, we are reducing the LDL, your bad cholesterol, and we do this with statin therapy, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the Nursing Studio. You can give us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1, at gmail.com. Everything that I offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.